friends. Today we are going to discuss about the antiviral drugs. Outline. In this topic, we will discuss about important antiviral agents such as acyclovir and valcyclovir, oseltamivir, and anti-HIV agents. The antivirals are classified into anti-herpes drugs, anti-influenza drugs, anti-hepatitis agents, and antiretroviral drugs, also known as anti-HIV drugs. The anti-herpes drugs include acyclovir, valcyclovir, ganciclovir, and foscarnet. Anti-influenza agents are ampicillin, oseltamivir, and zanamivir. Anti-hepatitis virus agents are, for hepatitis B virus infection, we use lamivudine and tenofovir. For hepatitis C virus infection, we use ribavirin and interferon alpha. Antiretroviral agents for anti-HIV drugs. They can be nucleoside reverse transcriptase inhibitors such as zidovudine, lamivudine, stavudine, and tenofovir. Non-nucleoside reverse transcriptase inhibitors are nevirapine and efavirenz. Protease inhibitors include ritonavir and intinavir. The newer drugs are enfuvirtide, which is an entry inhibitor, and integrase inhibitor, that is valsartan. Among anti-herpes agents, acyclovir is the most important drug. Mechanism of action of acyclovir. It will enter the viral infected cells, and the thymidine kinase enzyme converts it into acyclovir monophosphate. Further conversion to acyclovir diphosphate, and finally it is converted to acyclovir triphosphate. They inhibits viral DNA polymerase enzyme and inhibits the elongation of DNA strand and also inhibits viral replication. Spectrum of acyclovir is effective only against all herpes virus such as HSV1, which causes oral herpes, HSV2, which causes genital herpes, and it is also active against Klebsiella zoster viruses, which produces chickenpox. It is also effective against Epstein-Barr virus, which is a causative organism of infectious mononucleosis. Pharmacokinetic properties of acyclovir. The preparations can be available for oral administration, intravenous administration, and topical administration. For topical usage, we can use ointment or eye drops, etc. Can cross the blood-brain barrier. It is mainly excreted through renal system, and it is safe in pregnancy. Adverse drug reactions of acyclovir include headache, nausea, vomiting, and there is reduction in glomerular filtration rate, which causes toxicity. Uses of acyclovir can be used for the management of herpes labialis and oropharyngeal herpes simplex infections. Topically, 5% of acyclovir cream is available. It is applied 5 times daily. Tab acyclovir 200 mg to 400 mg 5 times daily orally is given. For herpes genitals, and we can also use it for the management of herpes simplex, encephalitis, and chickenpox and herpes zoster. These are the uses of acyclovir. We can use it for all type of herpes virus infections. The anti-influenza agent is oseltamivir. It is a neuraminidase inhibitor. They inhibit neuraminidase enzyme and inhibits the release of daughter virions. The spectrum includes they active against influenza A virus and B virus and also active against bird flu and swine flu. Adverse drug reactions include nausea, abdominal pain, and insomnia. Uses of these drugs is the drug of choice for the treatment and prophylaxis of swine flu and bird flu. We give Dept 75 milligrams twice daily orally for 5 days. The commercial name of this tablet is Fluvial. Here is a clinical case. Right in the OPD, if doctor got any prick accidentally from an unknown patient, the serological result of the patient came as HIV positive and the patient was on treatment for AIDS, but he does not reveal the proper history. So what's the further management? Here, the case, a patient got a needle prick from a patient and from an unknown patient who is HIV positive. Then the management of this case, the doctor has to be taken HIV prophylaxis. So our next topic is antiretroviral agents. HIV virus is a single-stranded RNA virus. It is also called as retrovirus because in contrast to other viruses, here the DNA is transcribed from RNA. So the enzyme responsible for this process is known as reverse transcriptase enzyme. Suppose it is the T lymphocytes, the HIV virus undergo uncoating and they attaches the infective particle into the corresponding cell, and there is release of viral DNA by uncoating process. And in presence of reverse transcriptase enzyme, there is synthesis of viral DNA occurs, and this viral DNA incorporated into the host DNA. They integrate into the host DNA and undergo multiplication to form viral particles. So the agents used for the management of HIV infection, some are reverse transcriptase enzyme inhibition. They causes inhibition of the reverse transcriptase and inhibits the synthesis of viral DNA. The agents are NRTI and NNRTI. NRTI means nucleoside reverse transcriptase inhibitors and NNRTI means non-nucleoside reverse transcriptase inhibitors. Some are protease inhibitors. Some inhibits the attachment and fusion. These inhibitors are known as fusion inhibitors. Some are integration inhibitors. These are known as integrase inhibitors. Classification of antiretroviral agents. These can be NRTI, that means nucleoside reverse transcriptase inhibitors such as sidoudin, lamivudin, stavudin, and tenofovir. Some are non-nucleoside reverse transcriptase inhibitors such as nevirapine and efavirenz. Some are protease inhibitors such as itranavir and intinavir. Newer drugs include entry inhibitors such as enfuvirtide and integrase inhibitors such as rapidavir. NRTIs, example sidoudin, lamivudin. Sidoudin is the most important drug. Compared to sidoudin, lamivudin has less toxicity and it is active against hepatitis B virus 2. Sidoudin gets converted to sidoudin triphosphate and inhibits the viral reverse transcriptase enzyme. Thus, the viral DNA synthesis is inhibited. So, it prevents the infection of new cells by HIV particles. Adverse drug reactions of pseudovirus include bone marrow suppression, anemia, and thrombocytopenia. For the management of AIDS, we can use pseudovirus along with other antiretroviral drugs. It is also used for the post-exposure prophylaxis of HIV along with lamivudine. Pseudovirus is also used for the vertical transmission of HIV. Vertical transmission means infection of the fetus from mother. Then NNRTIs include nevirapine and efavirenz. Mechanism of action. They bind directly to the reverse transcriptase enzyme and inhibit viral DNA synthesis. Protease inhibitors include ritonavir and intinavir. Mechanism of action of protease inhibitors. They competitively inhibit the HIV protease enzymes, prevent maturation of the virus, and it is effective in both newly and chronically infected cells. They competitively inhibit the HIV protease enzyme and prevents maturation of the virus. Adverse drug reactions of protease inhibitors include nausea, vomiting, increasing the blood cholesterol level, and dysphagia. Pharmacokinetics. These are enzyme inhibitors and cause toxicity of co-administered drugs because it inhibits the metabolism. Uses of protease inhibitors. It is used in combination with other antiretroviral drugs for the management of HIV infections. Adverse drug reactions include abnormal distribution of body fat. It also worsens with diabetes. Then about heart regimen, that means highly active antiretroviral therapy. In this case, we can use combination of the drugs to prevent emergence of resistance. It is used to suppress HIV replication. Usually, we use 3 drug regimens, which include 2 nucleoside reverse transcriptase inhibitors along with 1 non-nucleoside reverse transcriptase inhibitors. It includes lamivudine in all regimens. Example, lamivudine along with pseudovirus plus nevirapine. Here, the lamivudine and pseudovirus are NRTIs, and nevirapine is the non-nucleoside reverse transcriptase inhibitor. In advanced cases, we can also add a protease inhibitor along with this combination, and the patient requires lifelong therapy. For the management of HIV in a pregnant woman, we can use the drugs that are safe in pregnancy, such as pseudovirus, lamivudine, and nevirapine. The 3 drug regimen continued in pregnancy, and pseudovirus is given to newborn also for 6 weeks. And breastfeeding is contraindicated in case of HIV breastfeeding mother. Post-exposure prophylaxis of HIV is given to dentists, healthcare workers, etc., who have accidental exposure to HIV infections. The treatment should be started as soon as possible and not effective after 72 hours of post-exposure. Treatment regimen include if we have low risk, that means the source is HIV positive and asymptomatic, then we give 2 drug regimen which include pseudovirus and lamivudine. Pseudovirus given 300 mg twice daily along with lamivudine 150 mg twice daily for 4 weeks. For high risk patients, that is the source is symptomatic, Then we give 3-drug regimen, which includes sidovudine 300 milligram twice daily plus lamivudine 150 milligram twice daily along with Intinavir 800 milligram thrice daily for 4 weeks. In other words, every 14 seconds a child is orphaned by HIV. Summarize this topic. Acyclovir is an important anti-herpes agent. Mechanism of action, it inhibits the viral DNA polymerase enzymes. Spectrum, it is active only against herpes infections. Adverse drug reaction, there is renal toxicity, there is reduction in glomerular filtration rate. Uses is used for herpes labialis, genitalis, and herpes zoster. Then oseltamivir is an anti-influenza agent. It is a neuraminidase inhibitor. Is active against influenza virus. Adverse drug reaction is nausea. It is used for the management and prophylaxis for bird flu and swine flu. Sidovudine, which is an anti-HIV agent, it's an nucleoside reverse transcriptase inhibitor. It inhibits the reverse transcriptase enzyme. Adverse drug reactions include bone marrow suppression. Heart means highly active antiretroviral therapy. We use lamivudine, sidovudine along with nevirapine. Then about the post-exposure prophylaxis. It really depends upon the source of infection. The source is positive and asymptomatic, we use 2-drug regimen. And if the source is symptomatic, then we use 3-drug regimen. Important questions in this topic include acyclovir, management of herpes infection, classification of antiretrovirals, and northbound sidovudine. It's all about this topic. Thank you.